Bloating is normal throughout the day, but if you feel like you need to unbutton your pants, you can't leave your house because you're so uncomfortable with the bloating, you feel like it really impacts your quality of life, go get it investigated and don't take you're fine for an answer. There's always things that can be done.
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast.
Hi, everybody. Welcome back to another episode of the Advanced Women's Health Podcast. I'm here with Dr. Colie, and today we're going to be talking gut health. I'm Dr. Rebecca. I work at the Toronto West Clinic with a focus in skin and hair. You may have seen me before, but obviously, as we know, the gut and skin connection is huge. So that's my role in this podcast. But here we have Dr. Colie, who focuses in digestion and gut health. And I believe this is her first time here. So do you want to start by just giving us a little bit of information about yourself, what you focus on, how you got into naturopathic medicine, why you're passionate about gut health, all of that kind of stuff?
Yeah, for sure. Hi, everyone. So excited to be on the podcast for the first time. So yeah, as Rebecca said, I'm Dr. Colie. I have a main focus in digestive health. I also do a lot of endometriosis and nervous system dysregulation, low energy, fatigue, burnout, those types of things, which I find are always very interrelated. And the way I kind of got into naturopathic medicine was very similar to what I see a lot in my patients. So my whole life, since I was a child, struggled with digestive issues. I couldn't figure out what was going on. I know I did figure out I had gluten and dairy sensitivities, but avoided them. And it didn't really make a huge difference on the grand scheme of things. And as the years went on and I got into university, there was more anxiety and stress that was happening there. And I ended up having really low energy, super fatigued. Always, my stomach hurt constantly. It didn't matter what types of foods I ate. I just felt like something was always off. And I really actually grew up with a pretty naturopathic style to my life, where our family friends, their dad was a naturopathic doctor and a chiropractor. And we followed a lot of those philosophies. My mom worked in his office. She was a nurse and worked with him for a bit. So knew a lot about optimal nutrition, getting lots of movement in, the foundations of it all, but things still fell off for me. And I knew something was wrong, but blood tests would come back normal. Everything seemed like it was fine on the outside. And it wasn't until I got into university that I was like, okay, I need to explore this a little bit further. And within that too, I just felt like I grew a passion for nutrition, exercise. I did my undergraduate degree in kinesiology and just really wanted to kind of facilitate that further and dive deeper and help other people to not feel that type of way. And it actually wasn't until I went to a functional medicine practitioner where I really did a deep dive and figured out that I had a lot going on with my gut. I had SIBO, H. pylori, parasites, a bunch of different things just happening all at once. And once I cleared that, my fatigue lifted, my energy was so much better, my mood improved, everything just really improved and got so much better. And yeah, that was actually while I was in naturopathic medicine that I ended up doing that. But my whole goal as I was in naturopathic medicine was to help people improve in those aspects and really feel like they can take on life in a way where they don't feel like they're stuck.
Well said. For sure. You sound like a lot of my patients.
Yeah.
So essentially, we're kind of going back to basics, gut 101. I feel like with a topic that's relevant to almost everybody, and that's just bloating. What is bloating? What causes bloating? How do we diagnose bloating? How do we treat it? How would you sort of define bloating? How do you identify bloating?
Yeah, so I mainly identified bloating with it being sort of that distended, tight, gassy, sometimes a little bit of a painful sensation in that stomach region. Sometimes people will say, I can't button up my pants. I was able to wear them earlier, but now I feel like I need to unbutton them. And it's kind of that progression of like it's not a normal constant thing that's going on. So bloating can happen after eating. It can happen during certain phases of your menstrual cycle. For some people, it can just come up out of nowhere. Sometimes your stomach will look visibly distended, but sometimes it just kind of feels full and heavy as well. Like a lot of people I find have that bloating in that lower stomach area. That's sort of the main area of complaint, but it can sort of radiate up into the like upper like stomach region as well. And some people will feel that pressure that kind of goes up even into like their throat sometimes if there's enough bloating going on.
Yeah. And I think it doesn't always come with gas either. You can either be bloated with gas, bloated without gas. But I think as we are going to kind of continue today, essentially bloating to us means that like full sensation of the stomach.
Yeah.
And I mean, at least for me, I would say that bloating is probably relevant to every other patient I see. It's rampant through my patient population. Why do you think it is that bloating is such a common complaint that we hear or that we see in naturopathic practice?
I feel like it's just that there's so many factors working against us nowadays when it comes to our gut microbiome, our hormones, environmental factors, exposures to illnesses. There's just a little bit of everything in so many different places. And the standard American diet doesn't really help facilitate a healthy gut microbiome for the most part. There's so much accessibility for quick, easy processed foods, saturated fats, and things that are just foods that are low in fiber, which really makes it hard to maintain an optimal gut microbiome for sure. And then there's also medication influences like frequent antibiotic use or daily stress, things, and like people being a little less active nowadays as well, especially with COVID, that I feel like really turned people's worlds upside down and people just aren't as active as they used to be. And that can all be influences into our gut and impact bloating.
Yeah, for sure. And I mean, the way I see it from like a root cause perspective, the gut is sort of like the epicenter to health in a lot of different ways. It can be influenced by so many things, or it can be the root cause. So we talk a lot about insulin and hormones and stress and nutrient deficiencies. And I think the gut kind of plays a very direct role in all of those things. So it's almost like a representation of something else or like a signal that something else in the body is also off. So it's kind of like one of your keynote things that shift anytime you sort of have dysfunction in the body.
I totally agree. Yeah,
absolutely. And if you sort of had to describe what normal bloating looks like there are certainly instances where our gut isn't necessarily happy. Like how do you as a naturopath sort of distinguish normal, and I don't like using the word normal because like everybody is different, of course, but normal versus abnormal bloating? Like how do you know when bloating is a problem and bloating is something that you need to address in your treatment plans?
Yeah, so sort of like the quote unquote normal bloating, or like just when it happens for people in those one-off times, if it resolves just in a few hours or by the next day, it's not really a frequent thing that happens, and you kind of know the trigger, then I feel like that's kind of a typical like sign of bloating. Like if you were to eat too fast or have a really large meal, you're having a lot of like really fried foods or foods that produce a lot of gas, like beans or carbonated beverages or alcohol. Yeah, exactly. Anything that just builds up that gas in your body. And you're kind of like, okay, I know why this is happening. That can happen and just kind of be a one-off thing. But yeah, I feel like when there's cause for more concern or investigation is when it's more of that long-standing bloating that's really persistent. You can't really pinpoint why it's coming up or when it's coming up. This like, and it can even be when you're having foods that are nutritious. So then it's frustrating because you're doing what you think are the right things, but you're still feeling like garbage. And that's really difficult. So in regards to kind of investigating things further and cause for concern, I feel like that would kind of be the main thing. And then also if you're bloating, like even when you're not having meals or smaller meals, or you wake up in the morning and you're already bloated before you even eat. Also when there's a lot of stomach pain associated with it, and it's just not going away with simple changes like modifying some dietary factors or adding in hydration, like drinking some more water, or there's other symptoms associated with it, like a lot of gas or reflux, nausea, or even other symptoms too, like if you have joint pain or skin issues like eczema, acne, and even cognitive things, brain fog, fatigue, like all of these can be impacted by our gut microbiome, which usually is the main cause of bloating, but there are other factors too.
Totally. Well said. I would 100% agree with that. So it's, if you bloat those days where you're not eating great or drinking or eating too much, that kind of thing, definitely that's more of okay, it makes sense why that happened. But the chronic sort of persistent, and I like how you said when you're trying to do all of the right things and you still have a problem, like eating healthy and getting in fiber, all of that kind of stuff. And then it's like, okay, well, the gut is almost now a barrier to doing the healthy things that we need to do to sort of treat the rest of the body. Or even sometimes, I have patients who come in with certain cheap complaints and I'm like, okay, I need you to take all of these supplements. And they're like, every time I take a supplement, it makes me feel sick. It makes me nauseous. So it's like, okay, we need to treat the gut first and kind of like address that barrier to getting in all of the other things.
Exactly. I totally agree. And even like there are patients that I have that they are like, I can't even eat healthy right now because my stomach hurts so bad. It doesn't matter what I eat, I'm in pain, and then I don't have the energy to cook. So I just eat whatever is convenient for me because it kind of gone past that point of like, I'm so bloated, I'm so uncomfortable, but I don't really know what's causing the issue. So I'm just like, yeah, exactly. Like until you know what's going on, it's not really worth making the dietary changes in a sense.
Yeah, absolutely. Perfect. Okay, so now that we kind of understand what bloating is, what it looks like, what's abnormal from a bloating perspective, let's get into sort of what causes bloating, right? Obviously, we know the gut is involved. We know other systems are involved. How would you sort of describe the role that gut plays in bloating or other systems? Or tell me what your root cause of bloating is.
Yeah, so your gut's home to trillions of bacteria, which are going to help your food digest. The bacteria produce gas as a natural byproduct. So when there's an imbalance in this bacteria, for example, if you have too much of the wrong bacteria or an overgrowth of bacteria in the wrong place, like in SIBO, which is small intestinal bacterial overgrowth, gas can really build up excessively and lead to that bloating and discomfort. And then our gut also will produce enzymes and stomach acid, which are big factors for breaking down our food. So if our stomach acid is too low, which is actually so common, I know a lot of people when they get reflux and whatnot think that they have high stomach acid, but a lot of times it's low. And there's not enough stomach acid. There are not enough digestive enzymes being produced. So our food isn't going to be digesting fully. And it's going to lead to more fermentation and bloating and constipation. And then also just ensuring that smooth movement of your gut, of food going through, is really important too. So that's called motility, is kind of that ability for things to move along in our gut. And it's that motility, exactly, bowel movements.
My favorite topic.
Yeah, honestly, I feel like we talk about it all the time in naturopathic medicine. It's so funny. And people are like, this might be TMI, but no, nothing is.
Give me all the deets.
Exactly.
100%.
But motility plays a huge factor in our digestion and making sure that we're having optimal bowel movements. So if our motility slows down, it could be from things like diet, stress, usually things along those lines, but food will sit in the gut for longer and ferment, and that's going to also cause more bloating and pressure and gas. And that can get progressively worse as the day goes on as well.
Yeah. I think it's easy to sort of forget that having regular bowel movements and motility is actually like one of your body's defense mechanisms, right? It's this constant movement, moving through, clearing things out that doesn't allow for the bacteria that live in there to overgrow. It's kind of just like keeping things nice and regulated just by matter of movement, I guess.
Exactly. Yeah. It's one of our main forms of elimination. And if you're just there's also hormones and whatnot that we eliminate through our stool. So it's such an important factor to really ensure that you're having those optimal bowel movements, for sure.
For sure. So from a bloating perspective or root cause of bloating, the way that I kind of like to look at it is, okay, locally, what's going on in the gut to cause bloating? As you mentioned, you have a functional deficiency. So you're not making enough acid, enzymes, bile to actually digest your food properly. Is there some sort of imbalance in the species inside the gut? So are there bad bugs in there that are fermenting food and causing you to bloat? Are there issues with your motility? So are you not sort of moving stools through correctly, which is causing bloating? And I think the other one to mention is sort of like inflammation or a breakdown of your gut lining. If your gut lining is disturbed and food is becoming inflammatory, that can also be sort of a similar sensation to bloating, which can involve food sensitivities. Or I think another one that people forget about often is even like not eating enough. So I have a lot of patients who don't eat on the regular. They have coffee for breakfast and lunch and then have this sort of stomach irritation. And then when they do end up eating, they just get super duper bloated, right? So that's almost an irritation, inflammatory kind of perspective. And also the fact that you haven't been producing digestive enzymes and acid the whole day, and now your body's suddenly like overwhelmed with this big bolus of food to eat. And then we also have all of our pillars of health, right? We know that the gut can be a sign of insulin resistance, of issues with the liver, hormonal problems, stress, like all of that kind of stuff. And we'll get into a little bit more of that. If you sort of had to describe some of those root causes from a pillars of health perspective, what kinds of things are you looking into from that sense?
Yeah, that's a great question because like we talked about in the beginning, everything is so interrelated. So a big thing is our stress response. That is a huge factor. So looking at stress, anxiety, and whatnot, that can impact our body's ability to break down food and digest and move things along as well. So for example, when it comes to that gut-brain connection, so our brain is connected through our gut through the vagus nerve, which is this big nerve that goes down to our gut, and it really helps with motility and that rest and digest. If you've ever heard of like fight or flight and rest and digest, that is responsible for rest and digest and moving food along in the gut. So if you're really stressed, the vagus nerve isn't being stimulated enough, and then you're not able to move that food along. So if you find when you're really stressed out, you're like, I can't have a bowel movement, or even physical stressors, like when you're flying and whatnot, and you become really constipated, that can be a big reason for it. And then another one can be looking at your liver and gallbladder as well. So if your liver isn't functioning properly and kind of like filtering things out efficiently, not producing bile properly, then our gallbladder isn't able to secrete that bile and break down food efficiently. That can be stress related as well. It can be from other factors too, but those are two of the main ones I would say. And with bile as well, like a big thing is it really is responsible for breaking down fats, especially. So if you find you're bloated after eating really fatty meals, that can be a big factor for that as well. But Rebecca, do you have other ones that you find are really common that you end up seeing?
For sure. So the way I would sort of describe it when we're trying to treat bloating or resolve whatever's going on just in general is obviously we're going to treat the gut locally, right? Using all of the things, all of the tools in our toolbox. But at the same time, we need to figure out, okay, why did the gut get this way in the first place, right? And in order to do that, we're looking into our typical pillars of health. So if there's anything going on with insulin resistance or blood sugar, we know that in people who are insulin resistant, we're sort of feeding specific types of bad bacteria and impacting metabolism in that way. We know that the liver is very important in terms of sort of establishing that immune system at the level of the gut. So if something's off with the liver, we need to address that. Obviously, nutrient deficiencies are kind of like the base. If health was a pyramid, they're the base of the pyramid in the sense that if you're nutrient deficient in any kind of way, your body's not necessarily going to act in the way we expect it to act. If there's any sort of other inflammatory sources, mitochondrial function, all of sort of your typical things. So the way that we address bloating and gut health is that we treat it locally, and then we go back to our basic pillars of health, figure out if there's anything in there that needs to be adjusted so that we're sort of maintaining that work that we've done locally at the level of the gut. And then, yeah, the stress response, absolutely, 100%. You can also talk about endometriosis and other sort of inflammatory reproductive concerns. They can sometimes look like bloating. You already mentioned medication, supplements, all of those kinds of things. So now that we understand bloating, we understand the root causes, all of those kinds of things, let's talk about clinical practice. So how do you assess gut health and investigate the causes of bloating? So we talked about all these different causes, all these different gut health causes, these pillars of health causes. What kinds of things do you look for when you're talking to somebody to sort of discern what's going on?
So I really like to start off by seeing when this bloating started. So what is that never well since point, or that time that you're like, okay, like, yeah, around this time was when things started to feel off. So that could be around time of when you traveled somewhere and you got sick and then your gut's never been well since, or you were under a really high bout of stress and things just kind of progressed and you haven't been able to get back to where you were before. For some people like myself, like it's been since childhood. Looking at that starting point really helps understand, why is this bloating happening and where is this coming from? What's that potentially that main origin? And then going off of further symptoms as well. So looking into, like we mentioned before, like, is there a lot of gas with it? Is there constipation, diarrhea? What do those look like? Really looking into bowel movements on a deep level. It's a very common, like,
We love bowel movements.
It just helps us investigate what's going on internally. Like, it really is helpful. And then going off of two, are there other sort of symptoms with it? Do you feel that like there's some reflux sitting there, some pressure? Is there stomach pain going on as well? And if so, which location is that in? Because that can tell us if there's something going on with the liver or certain parts of your intestines, looking into things like that. And then any other like influences as well that could be contributing, or other symptoms that could be from the bloating. So like I mentioned previously, like joint pain, fatigue, really low energy, changes in mood, skin conditions, those types of things are really important to look at in regards to like investigating with the patient.
Yep, for sure. So subjective sort of taking an intake during an appointment and figuring out what kinds of symptoms people have, gut related and independent of gut. And then what kinds of diagnostics do you use? Or we're all about our blood work. So what kinds of blood work, diagnostics, those kinds of tools do you use to help you diagnose and assess gut health?
Yeah, so I like to do blood work with patients to really look at, is there stuff going on with the gut? So for example, measuring urate, which is a waste product that comes off of bacteria. If urate is at a higher level, then we know that there can be something going on in regards to like possibly gut dysbiosis happening. So that's a good one to measure with blood work. Also looking at our nutrients and figuring out, okay, is there a deficiency in nutrients like iron, B12, vitamin D? Are you not absorbing things efficiently? Because that can also indicate maybe there's some damage to the gut lining that's really impacting our ability to absorb nutrients. And then looking at inflammatory markers like erythrocyte sedimentation rate, or ESR, or CRP, which is C-reactive protein. Those really help understand kind of that inflammation piece of things.
Inflammation coming from the gut.
Yeah, exactly. And looking at our red and white blood cells, how is that being produced? Is there enough? When it comes to white blood cells, are there a lot or are there too little? So like, is there an infection going on? Or was there a previous infection? So that really helps. Even different types of white blood cells. So for example, if you have a high level of eosinophils, which is a type of white blood cell, that could potentially indicate a parasitic infection. And then also you can do a celiac blood test as well. So if there is a family history of celiac and the patient is still eating gluten, we can do that test and see if that also could be a big indicator as well.
Which could definitely be causing bloating as well. I think we didn't completely, we mentioned food sensitivities, but didn't mention gluten sensitivity and celiac specifically, which is also super important.
For sure. It's becoming a lot more common nowadays, for sure.
Yep. Yeah. And again, from a blood work perspective, blood work gives us some information locally about the gut, but also tells us, okay, what other pillars of health are off that could potentially be involved in the gut health being off. And then that brings us into functional tests and things like that. So other options for testing the gut.
Yeah. So the main functional test I really like to run is the GI map, which is basically a test that helps for people who I recommend it to patients a lot when they have a lot of chronic bloating and symptoms for a long time. They've tried a lot of different things and they just cannot figure out what's going on and nothing really works for them. And basically in the GI map, it looks at a little bit of everything. So it's a stool test. And basically what it tells us is, are there parasites present, viruses, H. pylori, which is a bacteria that's usually found in the gut, but if there's high levels of it, it can lead to a lot of reflux and stomach ulcers. looking at that, looking at all the different types of bacteria in your gut, and are they high? Is there an overgrowth like SIBO, or is there too little bacteria? So you're not actually able to efficiently kind of digest and break up that food properly. And then it looks at, I don't know if I've already mentioned viruses. It looks at candida. It looks at your...
And what's candida?
Candida is a yeast that can overgrow in your body if your immune system is compromised. So it can really wreak havoc on your entire body, and also can, if it's internal for a long time, it can also start to manifest with more skin related things too, like rashes and breakouts and whatnot. So, which I'm sure, Rebecca, you see happening a lot.
Okay, so GI map is your functional test of choice, and then you can also get H. pylori and SIBO testing done individually as well. But the GI map is kind of the gold standard in terms of helping us understand all of those sort of local components to the gut, essentially.
Yeah, it tells you a little bit of everything, and it really allows you to pinpoint specifically how to treat, because you can make a lot of guesses based off of symptoms and blood work and whatnot, but this really tells us, okay, for example, too, even with a probiotic, there are so many different types of probiotics. So this can help us pinpoint what would be the best one for that patient, or even when it comes to antimicrobials, which are herbs that help to kill off bad bacteria and replenish the good bacteria. This kind of helps us be a lot more targeted and pinpointed to you as an individual.
Yeah, absolutely. And that's sometimes how I kind of explain things to my patients if they're not going to get a GI map. It is sort of a process of elimination to a certain extent because we can't tell exactly what's going on in there. Obviously, it can make an educated guess in terms of your symptoms and things like that, but it can be a little bit of try this supplement, see if it's an improvement, nothing happens, or it makes things worse, and that kind of like helps guide. But obviously, the GI map is ideal in the sense where it avoids some of that trial and error, I guess.
Yeah.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
Okay, moving on. So in terms of sort of red flags or specific symptoms you look out for that means that you want to refer, or, that there's something deeper going on, can you walk us through what those look like?
Yeah, for sure. So the main things that I see that would definitely be indicated for a referral is if there's abrupt, severe pain with the bloating, that's a big one. Nausea, vomiting, fever, that can mean there's possibly an infection going on that then is causing the bloating. So that needs to be investigated further, as well as severe diarrhea, or if there's constipation for days in a row and there's just nothing coming out. Then also looking at, is there blood in the stool? Are the stools tar colored? So like dark, sticky, which can indicate a GI bleed. There can also be clay colored stools, which are kind of lighter, and that can indicate an issue with bile flow, which can be due to either issues with the liver or the pancreas. And then also if a lot of bloating and like stomach things also come with unexplained weight loss, then that is big grounds for referring as well.
Yeah, well said. So we know about the root causes, all of those kinds of things. Now let's talk about treatment. So can you walk us through sort of your naturopathic approach to bloating? Obviously, you go through your assessment, gather all of the patient's symptoms, run blood work if you have to, run functional tests if you have to, and then what's next?
Yeah, so usually I'll kind of see which of the symptoms are the most prominent for that patient and what are the most persistent and treat accordingly. So usually it's a combination of things. But step number one, I always find, is getting those bowels moving. Making sure we're having daily bowel movements is step number one for sure. So if you're constipated, trying to relieve that constipation. So there are supplements you can take for that. Ensuring that there's proper motility as well. So whether that's kind of adding in something for stress support or and whatnot, or even liver support if there's issues with potentially with bile production, just making sure we're getting things moving is really huge. And then adding in antimicrobials is really helpful to just, like I mentioned before, they're so great to kill off that bad bacteria that could be causing higher amounts of gas in the gut, which can then decrease bloating. That can also help too with optimal bowel movements as well. And then depending on the patients and kind of what's going on, adding in probiotics and after that to build that good bacteria back up as well and really facilitate that healthy gut microbiome, super important. And then if somebody does have any issues with intestinal permeability, which is also, people like to call it leaky gut, which is just that inflammation and breakdown of the lining of the gut, working to heal that back up in the mucous membrane, which is a protective layer of the gut that really helps things move along. Making sure that lining is being healed up is really important as well. And then also just in conjunction with that, working on dietary factors, lifestyle factors like exercise and eating foods that really support the gut, having lots of great fiber, anti-inflammatory foods to add in, and then working on stress support too is really big that I work throughout all of that with patients too.
Yeah, for sure. Well said. So I think, I know I keep coming back to pillars of health, but essentially the way I kind of approach things is always looking first locally. What do we need to do from a local perspective? Do you need help with your stomach acid, your enzymes, your bile? Do you have an imbalance of bad bacteria that we need to kill off? Are you constipated and need to clear things out? What's going on with your gut lining? Is the integrity compromised from that perspective? And also sort of understanding the immune system of the gut as well and seeing if there's some help that needs to be given there. And then once we treat that, we also go back into blood work, pillars of health. What kinds of things do we need to treat from a root cause perspective? Insulin, stress, you mentioned, nutrient deficiencies, all of those kinds of things. And then doing those things in conjunction, the idea is we resolve dysfunction and then look into, okay, well, how do we maintain and sustain this sort of new healthy gut and body that was created? And that's sort of when it comes down to, okay, are you getting in the right foods? Are you making sure you're not, it's a diet and lifestyle conversation, essentially, I would say. Maintenance strategy, if you will.
Yes, definitely.
Perfect. So you mentioned all of these things a little bit already, sort of in your treatment regimen there, but can you kind of walk us through what probiotics do, what digestive enzymes do, what antimicrobials do? Because I feel like these are kind of like key supplements that people have probably heard of, but maybe aren't necessarily exactly sure how they play into the gut or what they do or how we use them as tools.
Yeah, for sure. So when it comes to probiotics, so usually I would include those in if there is a suspicion of low bacteria, for example, like after antibiotics, or if somebody's having a lot of diarrhea, things cannot stick and stay in there. So that gut bacteria needs to be replenished. So adding in some probiotics can be really important in that circumstance.
Rebuilding the good bugs.
Exactly. Making sure that there's that optimal kind of regeneration of them is very important because you can wipe out the bad stuff. But if you're not repopulating with good stuff, the bad gut bugs will start to grow back again.
Totally. And that comes down to the maintenance strategy too, right? If you're trying to figure out how to maintain, that means getting your healthy microbiome up and running because that's really what sort of protects you long term, right?
Yes, exactly. It's honestly so important. And when people too say, I've taken antibiotics, but these infections keep coming back again, then that's where we really need to investigate that more and where probiotics can come in for sure.
And with that being said, just to sort of hit on probiotics a little bit, because I know probiotics are definitely a hot topic. In terms of the different types of probiotics, like is a probiotic like it's good for everybody, or what's the story with probiotics?
So as I kind of mentioned before, different probiotics are good for different reasons, but it really comes down to time and place when it comes to probiotics. Because even I've heard of some patients saying, I've taken a probiotic and I started to feel a lot better, but now things are kind of coming back again and I don't feel so great, or it works temporarily, but now like I'm feeling like garbage when I take it. So looking at stuff from that perspective is really good.
I feel like I like to use probiotics from a species specific perspective. So if people are just generally low in their phyla, the main sort of bacteria that make up majority of the gut, if they're low from that perspective, that's when you're going to kind of go in with a more general probiotic versus if, they have a specific sort of issue that they're looking to deal with, maybe they need to go in with more specific probiotics. I guess what I would say is all probiotics are not necessarily created equal. So you kind of need to know what you're working with in order to choose what probiotics you need, or if you even need probiotics at all.
Yeah, for sure. It's
Not everybody needs probiotics.
Yeah, I feel like it is like a big go-to for people that if there's something's going on with their gut, they take a probiotic, but there's so many other factors that come into play, which we've already talked about, that there's also just specific timing for taking probiotics too. Like, for example, with antimicrobials, do we need to add that in first? Like I mentioned previously, do a kill, wipe out that bad bacteria to kind of start fresh, and then build up the probiotics and adding in fiber and making sure that things are kind of building up, the good gut bugs are building up and really staying in the gut and working optimally. And then when it comes to digestive enzymes, I find that I will prescribe them a lot for patients when they're not sensitive to any specific foods in particular, but they find if they eat a certain macronutrient. So for example,
what do you mean by macronutrients?
Yeah, so carbohydrates, fats, or proteins. So if somebody says, oh yeah, every time I eat like a fatty meal, I feel so bloated and uncomfortable. Or if I eat a lot of carbs, like if I eat like a plate of pasta, it doesn't matter what type of it is, what's in it, I feel like I really don't feel well. But if I have other, say, gluten or whatnot, they're like, I feel fine. So that's where I find that digestive enzymes can be really helpful for people. It's just to help break down that food efficiently and making sure that we're absorbing things properly and having those optimal bowel movements. And I also will prescribe it if I notice, or patients notice, there's undigested food in their stool as well, because it just tells us things aren't being broken down as efficiently as it could be. So digestive enzymes kind of give that little push sometimes that people need to make sure that they are optimally breaking down their food after meals and decreasing the risk of bloating.
Yeah, for sure. And digestive enzymes just being a little bit of stomach acid, a little bit of proteins to digest carbs, proteins, and bile acids for fat. Perfect. Okay, and what about antimicrobials? Tell us more about what antimicrobials are and what they do.
Yeah, so I've already kind of mentioned them a little bit, but there's, for example, some common antimicrobials are garlic is an antimicrobial, oregano, there's black cumin seed, there's berberine, so many, exactly, like so many different types of herbs that really just help to, we kind of will utilize them in a similar way to antibiotics, but they're a little more of like a broad range, because antibiotics are more specific to what bacteria is overgrowing for you specifically, where antimicrobials do kind of, they kill off kind of a mix of bacteria, but then they also have anti-inflammatory properties. They help kind of nourish that good bacteria and build things back up again too. So I find them really important to add in when people are just, they're bloated, uncomfortable, can't really figure out kind of what's going on. Adding a round in of antimicrobials first to kind of kill things off is, I find, very helpful, and patients really notice a big difference when they take them. And they're a temporary thing. You don't want to be on antimicrobials long term. It's just a temporary thing to help kind of replenish that bacteria, like what I've been talking about previously. But yeah, what's your take on antimicrobials, Rebecca?
Yeah, I would say very well said. And I think just sort of emphasizing the fact that even with all of these things, probiotics, digestive enzymes, antimicrobials, the way I see it, these are just tools to kind of locally fix dysfunction in the gut. The goal is not for you to just be on these supplements long term. And also, it is important to consult a professional in terms of sort of what you should be taking and what you need to be taking, because if you're taking antimicrobials when your gut is just completely eroded of bacteria, that's not ideal. It's not good for you, that kind of thing. So you have to use these things in an educated and in the proper way. So always get advice from your naturopathic doctor first, because you can definitely do harm to the gut if you're not taking the right thing. I have patients who were kind of like in perfect health and heard that they should be taking a probiotic, and then ever since taking a probiotic have kind of had gut health problems. So you always want to treat every patient individually and treat them with the things that they need. Not everybody should just sort of be blanket be taking these things if they have bloating, because as we've discussed, bloating can be caused by lots of different things. So you need to make sure you're taking the right thing for your case of bloating, for sure.
Yeah, definitely.
So we talked about sort of our key gut health supplements. Now let's talk about diet. So what role does diet play in this whole conversation? Are there bloating friendly diets, et cetera, et cetera?
Yeah. So when it comes to diet, it's very dependent on the person. So as I mentioned previously, when it comes to, there are some foods that are more, and drinks that are more gas producing, like beans, cruciferous vegetables, which are like your Brussels sprouts, broccoli, things like that, as well as sodas or carbonated beverages. These can produce a lot of gas really quickly in some people. So some people find that they can't do too much of those. There's also, for some people, when they're sensitive to things like gluten or dairy, it can really aggravate their stomach.
In terms of sort of being sensitive to gluten, being sensitive to dairy, can you elaborate a little bit on what the difference is between those two things, or like gluten sensitivity versus like lactose intolerance, and how there's sort of like differences in that sense?
For some people, there are things that they're sensitive to, like gluten and dairy, that can be super aggravating to their stomach. And the thing too is like some people can develop sensitivities as well if their gut lining isn't working optimally and their immune system is compromised then from that, because a lot of our immune system actually resides in the gut. So that can be a big thing. And then histamine rich foods can bother a lot of people too and cause bloating. So those are like aged cheeses, processed meats, alcohol, leftover foods. Fried foods can also be really aggravating to people because of the high fats, which are sometimes harder to digest for people. So when it comes to kind of bloating friendly eating, really making sure that in your diet you're having, or with each meal, you're having a good amount of protein, fats, and carbohydrates. That can really help promote optimal digestion and decrease that risk of bloating, and can help keep you full longer and decrease your cravings for snacking on foods that might make you feel more bloated. Like if you find that you eat a meal, but then you're like, oh, I'm still a little hungry, maybe I'll just have some chips or some little something, that then you're like, oh, well, now I feel worse. Like I was fine after my meal, but now after this snack, it kind of just aggravated things. This kind of helps just prevent that. Also, when it comes to ways of kind of cooking foods, having cooked vegetables instead of raw vegetables can also be very helpful too, just because cooking vegetables starts to kind of break them down without you having to digest them yet. So when you do go to eat them, there's not as much work that needs to be done with the gut to break stuff down. So there won't be as much bloating that can happen. And then there are different types of diets as well that people can do, like anti-inflammatory diets or the low FODMAP diet, or different ones like that that are also very popular, I find, in people that have bloating or gut issues too.
Yeah, for sure. I'll give you sort of my 2 cents on diet. So obviously we know diet plays a huge role from a gut health perspective. Usually from a dietary perspective, we're identifying triggers, like you mentioned. Is this person sensitive to certain things? Obviously, we know there are things that are just bad for everybody's gut. It doesn't matter if you're sensitive to them or not, being sugar, alcohol, processed foods, unhealthy fats, that kind of thing. And then you have sort of like your important gut health foods that we know need to be in the diet to sort of maintain. Like we talked about treating the gut locally and then figuring out how to sustain that. I always look to making sure you're getting adequate nutrients for the gut, right? And those are going to be getting in enough fiber, because the good bacteria in your gut eat fiber. Polyphenols are important for feeding certain species and maintaining your gut lining. And then fermented foods. So I always try to incorporate those things when we move sort of into a long-term maintenance strategy. I think the other thing to consider from a dietary perspective is sort of like timing and behaviors. Like I mentioned earlier, I have a lot of patients who have coffee for breakfast and lunch and then only have this like ginormous dinner. The gut doesn't love to be challenged in that sense. So having proper eating habits, meaning when you do eat, sit down, chew your food, try to pay attention to what you're eating. Don't go to, I mean, fasting is one thing and that can be beneficial if it's used properly as a tool. But, generally you don't just want to be eating totally sporadically or skipping major meals consistently, unless of course you're working on certain things. And the other thing is snacking too. You don't want to just be continuously eating, grazing all day, because your gut doesn't like that either. So basically anytime you put food in your mouth, we talked a lot about motility, your motility is going to stop. So if you're always eating all day, you're going to have sort of a stagnant gut, which is also not ideal. So I think it's important to remember diet in terms of when and how you're eating too. So those are all things we talk about from a sustainability perspective and from a treatment perspective too, for sure.
For sure. Yeah. Your gut loves routine. It wants routine and predictability. And also it needs time. It needs breaks in between meals to kind of come back down, like digest things, and then have a little break before you're adding more food in. Like you're saying with snacking all day, it doesn't give your body enough time of a break to kind of make sure that everything's digested and that your gut is feeling ready to take on the other food that's now coming back into your stomach again.
Yeah, for sure. Okay, in terms of sort of closing thoughts, what's one simple thing or one simple change you think someone can try today if they're struggling with bloating? I know that's a hard question, but
it is. But a really simple one is chew your food. Make sure.
That's what I was going to say too.
Yeah, it's such a big one. But even like I catch myself a lot of times where I'm like quick in a rush and just want to eat really, like get my food down and get out the door. But just sitting there and chewing your food, making sure you're taking that time to really like chew it until it's basically liquid. I know that sounds gross, but it really helps with digestion and also kind of getting rid of distractions as well when you're eating, being more mindful of how you're eating. I know a lot of people, it's so easy to kind of watch a video as you're eating food and have that, but it can be really distracting and take away from your digestion. So it can really help decrease your bloating if you just chew your food a little more and be a little more mindful too of how you're eating.
Yeah, well said. And I think we live in this modern day world where multitasking is like, I definitely have a problem doing one thing at the same time. I mean, one thing at a time.
Yeah.
And I'm certainly guilty of eating while watching TV, like 100%. I think mine would be something that I already mentioned previously, and just the fact that I have a lot of patients who really just don't eat very much. And when they do have that huge meal at the end of the day and they eat super fast while they're doing other things, their gut's just not happy with that. So be nice to your gut and give it food regularly, and don't expect it to be able to just digest this like sudden influx of like food when all you've been giving it is black coffee all day.
So fair. I mean, I feel like we would all love to just live off of coffee, but
would it be for sure? Any final closing sort of questions? Any misconceptions about bloating or gut health that you wish was more readily understood?
yeah, I feel like with bloating, it shouldn't be something that you just accept. I know that I've had people even tell me previously, oh, I have a horrible reflux, but oh, that just comes with aging, which your stomach acid does decrease as you age. But like if you just feel like something's off in your gut and that you need to investigate it further, please do it. And bloating is normal throughout the day, but if you feel like you need to unbutton your pants, you can't leave your house because you're so uncomfortable with the bloating, you feel like it really impacts your quality of life, go get it investigated and don't take you're fine for an answer. There's always things that can be done.
Yeah, I would agree with that. I think just to add on to what you said, I think that people like bloating is so common and so like normal to people that they don't even really realize that it's sort of a sign that something's wrong. Like I often have initial appointments where I go through the gut health intake and they're just like, no, I don't have any gut problems. I'm not bloated. And then at the second appointment, right when we've kind of gone through everything, they're like, I've been thinking about what you were asking before. And like, I definitely have gut health problems and I'm definitely bloated all the time. But it just kind of takes you like planting that seed and then like recognizing after you sort of describe it, that's not necessarily normal. But I can't tell you how many times that happened, truly. So I think it's just one of those things that people think are sort of like a part of the day to day. So just like you said, if something feels like maybe it's off, like just check it out and see, because it could be a huge sign that there's other things going on for sure. And other things, and when I say other things, I mean, if you come in because you want to treat acne, we need to know if gut health is off, because that's a huge sort of part of the conversation. So
yeah, for sure. And that's, I mean, the whole reason why we made this podcast episode specifically is that it is such a common thing. Yeah. It's something that so many people deal with. And it's just normalized nowadays that, oh yeah, I'm bloated all the time and that's just how it is. And
or I have IBS, like
yeah, when there are further investigations that can for sure be done and really ease that bloating and make you feel a lot more comfortable, for sure.
Agreed. Well said. Well, I think that answers all of my questions. Thank you for doing this podcast with me.
Yeah, thanks so much for being on here with me, Rebecca. Yeah, you can catch us both at the Toronto West location of Advanced Women's Health. You can book online with us, or even if you are just wondering kind of how we could help as naturopathic doctors, you can even book in a meet and greet and we can talk about things a little bit further and see what's going on. And yeah, investigate things more.
Perfect.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.